Hepatosplenic T-cell lymphoma. This entity falls under the extranodal category of mature T-cell lymphoma. And this entity is extremely rare, and also patients with hepatosplenic T-cell lymphoma tend to have very poor prognosis because the disease is very aggressive type of non-Hodgkin lymphoma. It primarily affects young adults and is characterized by the infiltration of malignant lymphocyte into the liver, spleen, and bone marrow, and is often associated with immunosuppressive therapy, particularly in patients who have inflammatory bowel disease who have been treated with medication like azathioprine, cismarcatopurin, and infliximab. Clinically, patients present with hepatosplenomegaly, and a very small percentage of patients can experience hemophagocytic syndrome. Morphologically, sinusoidal involvement is common in liver, spleen, and bone marrow. And here, liver is showing the sinusoidal involvement of the neoplastic cell. All these neoplastic cells in hepatosplenic T-cell lymphoma are medium and usually medium, but also can be small. And erythrophagocytosis can also be seen in bone marrow and other organ. And phenotypically, it marks a T cell, so CD3 is positive, and CD2 is also positive, and they are also expressing cytotoxic markers such as TIA1 and granzyme. CD4 is negative, CD5 is predominantly negative because it's gamma delta. It sometimes can be positive, and CD8 is also mostly negative. CD56 can be positive in rare cases, and 75% of all the lymphoma are gamma delta, and 20% can be alpha beta, and 5% is negative for both gamma delta and alpha beta. Isochromosome 7 is commonly seen in hepatosplenic T-cell lymphoma. Few cases show trisomy 8. STAT5B and STAT3 are also seen as part of the JAK-STAT pathway, and ARID1B, INO80, and SETD2 are also seen as part of the chromatin modifying gene. Pathogenesis is mostly due to a small subset of gamma delta T cell receptor expressing lymphocyte. They um, become defective and they start proliferating. And this is liver being infiltrated by these neoplastic cells, predominantly medium size. They are irregular nuclear contour and kind of dense hyperchromatic nuclei. And these neoplastic cells are involving in a sinusoidal pattern. CD3 is highlighting sinusoidal pattern of the neoplastic cell. This is a bone marrow. It's showing a very subtle involvement by the hepatosplenic T-cell lymphoma, and they can be highlighted by CD3 and all the other immunophenotypic marker that is specific for hepatosplenic T-cell lymphoma, which will be shown later. And the bone marrow involvement, again, in the higher power, we can see these neoplastic cell that are medium size, and they have sometimes can have like very occasional prominent nucleoli, but they are small to medium in size. And this is the lymphocyte that is neoplastic and showing these. The red arrow is highlighting this irregularity, and also can have these vacuole, and they commonly show these azurophilic cytotoxic granule as shown by the green arrow, and nuclear chromatin is loosely condensed. These neoplastic cell in the bone marrow, when you go to high power, you can see these nuclear nuclear chromatin is slightly resembling blasts, and they have an irregular nuclear contour. And again, just to show in different picture that we do have these medium-sized neoplastic cell with irregular nuclear contour. They um, can be very subtle, but they are highlighted by immunophenotypic specific one. It's just CD3 and the one that I will be mentioning later on. And this is CD3 staining that is showing the sinusoidal infiltration of the neoplastic cell. And this is for liver, and we can see that all these neoplastic cells are involving in a sinusoidal fashion. And also CD3 is highlighting all these neoplastic cell in the sinusoidal infiltration. This is the spleen is on the low power is involved, and the red pulp is mainly the one that is involved by the lymphoma. Here, in the white pulp is intact and not really involved by the neoplastic cell, but the red pulp is extended in the low power. If we go to high power, you can see the red pulp expansion, and also these neoplastic cells are diffusely infiltrating the sinuses and cord, and they are all neoplastic cell of hepatosplenic T-cell lymphoma. And it's the touch imprint of a lymph node. And lymph node involvement is extremely rare in hepatosplenic T-cell lymphoma, but here is showing these similar findings in bone marrow, xerophilic granule, and nu nuclear contour is like kind of slightly condensed. And CD3 typically shows sinusoidal pattern, and CD4 is negative predominantly, and CD8 can be negative, but can also be positive in rare cases. And gamma delta is usually positive, and TIA1 is positive. Sometimes it can be just very patchy or sinusoidal pattern. This is split in the top A and B are for spleen, and what we see here is just the neoplastic lymphoid cell infiltrating in the core and sinuses of the spleen that they are usually small to medium, but over here we're seeing small neoplastic cell. On the high power, we can see that these neoplastic T cells are highlighted over here by the tall arrow. They're medium size and demonstrate fine chromatin that kind of looks like a blast. And also here, this is one of the erythrophagocytosis, and so these we can see these red cell being hemophagocytosed by the lymphoid cell. And this is the bone marrow. See, in the bone marrow is showing this very subtle involvement by these neoplastic cell in a sinusoidal infiltrated pattern, and they are again highlighted by CD3 in a sinusoidal expansion by all the neoplastic cell. And if we compare and contrast with the two closest differential, which is TLGL and TPLL, so there's some comparison I would like to describe. The morphologically, hepatosplenic T-cell lymphoma will see sinusoidal infiltrate, and spleen will show just red pulp expansion, and red pulp is being involved. It can show erythrophagocytosis in some cases, but not very specific feature. And phenotypically, it marks a CD2, CD3, TIA1 positive, granzyme positive, and CD4 is negative, CD5 is usually negative, CD8 is usually negative, CD56 can be positive, and gamma delta is the type predominantly, so 75%. Alpha beta can be positive in 20%, and 5% is alpha beta and gamma delta negative. Isochromosome 7q is usually seen in hepatosplenic T-cell lymphoma, and trisomy 8 can also be seen. Step 5 and step 3b are mutated in some cases. ARID1B, INO80, and ZD2 can also be seen as a mutated gene in hepatosplenic T-cell lymphoma. And TLGL patients are clinically indolent. They usually present with neutropenia, and autoimmune manifestations are likely associated in TLGL patient. Bone marrow infiltration is either interstitial or intrasinusoidal, and peripheral blood will show numerous LGL like the one depicted here with a lot of large granule in these lymphocytes. They are large, and phenotypically CD8 positive and CD57 positive, and they are TCR alpha beta positive majority of the time. Cytotoxic markers are also expressed, TIA1, granzyme, and perforin. Chromosome abnormality is none being reported, but gene mutation is usually seen in TLGL is STAT5B and STAT3. TPLL is another differential for our entity. And morphologically, these neoplastic cell can show the architecture of diffuse and interstitial. Peripheral blood can show very kind of unique pattern. And these cells are small to medium in size with prominent nucleoli, and they also have cytoplasmic blubbing. So when you see this blubbing, just think of TPLL as one of the top differential. Phenotypically, CD4 positive, CD8 negative is seen predominantly, and also when you see dual positivity, think of TPLL. And CD4 negative, CD8 negative, dual negative cases can also be seen in about 15% of the cases. Inversion 14 or translocation 1414 uh, would render TCL1, and that's commonly seen in TPLL cases. Other few cases can also show translocation X14, which will then show MTCP1 mutation. And JAK-STAT pathway can also be involved in a few cases that will then show JAK1, JAK3 mutation, STAT5B, and SAMDH1, and also be seen in 20% of the cases. This is just another repeat slide just to summarize the hepatosplenic T-cell lymphoma, that spleen, bone marrow, and liver can be involved in it. Sometime interstitial pattern, but majority of the time it will show sinusoidal pattern, and patient usually present with hepatosplenomegaly. Very rare subset of the cases will show hemophagocytic syndrome. And morphologically, these neoplastic cells are small to medium in size. Erythrophagocytosis can be seen. Phenotypically, CD2 positive, CD3 positive, TIE1 positive, granzyme positive, CD4 negative, CD5 negative, CD8 negative, and CD56 positive. TCR gamma delta can be positive in 75% of the cases of hepatosplenic T-cell lymphoma. 20% can be positive for alpha beta, and 5% can be negative for both gamma delta and alpha beta. Isochromosome 7q is seen in hepatosplenic T-cell lymphoma. Trisomy A can also be seen. STAT5B and STAT3 can also be seen in hepatosplenic T-cell lymphoma. And with that, I would like to thank you for watching.